My dad, he was born in Kerala, in Trichure, and he grew up there as the youngest child in a family of four. He had an older sister and two older brothers, and his father was a rice merchant, or he was into wholesale rice business, and he did his undergrad, 10th standard and his pre-university in Trichure, and it was his desire to do medicine. And at that time, there were no medical colleges in Kerala. So he applied to Stanley Medical College and he was admitted there. And it was his determination that got him there. As you may be aware, as a child, he had polio, and that made him have a little disability in walking and some sort of a physical disability, especially for mobility. Then he passed out from Stanley Medical College, and then one of his classmates was Dr. Vishwanathan, who is a famous diabetologist in Chennai. Now he's no more. He joined with him and started private practice. During that time, the Kerala government deputed him to go for higher studies because they wanted some of the Kerala or people belonging to Kerala go and do higher studies, come back and start government medical colleges in Kerala, so that they can be part of the faculty there, and and so that more medical colleges can be started in Kerala. That's how he went to Cambridge, and he completed his PhD in physiology there. And once he came back, he joined as a faculty in the Department of Physiology in Government Medical College, Trivandrum. And there were only 3 medical colleges at that point of time. One was in Kottayam and the other was in Calicut. Okay. So that was the beginning of his career, where he just joined as a faculty of physiology in the Government Medical College, Trivandrum. He was very dedicated to his work, and at a very young age, he was made a special officer by the government of in Kottayam, and he was appointed there at the young age of 38. He was given full, control of full responsibility to acquire land, to build the buildings and start a medical college there. So that's how from Trivandrum he went to Kottayam and then to Calicut, where in both these colleges he was the founder principal, and then he came back to Trivandrum, and that is where Father Jonas Taliath, who later became the bishop, met him and requested him to come to Bangalore and be the dean of St. John's Medical College. So he was made responsible in starting Sri Chitra Tirunal Medical Center, which had not yet started at that time, but he was given the responsibility to start it and oversee the development of it. And so there was a big responsibility on his shoulders at that point of time. That was in 1973. So he had taken up that responsibility and he was going through that process when Bishop Taliath came and met him and requested him. And we were almost 100%, we were planning to settle down there. We are a family of 7 children, and to relocate the children, who are studying in a different language setup, like Malayalam and Hindi was the third language, Malayalam was the second language for us, and come to Bangalore where Kannada and Hindi was again there, and the syllabus was different. We were not in the ICSE syllabus at that time. So it was a very tough decision for my parents to move from Kerala to Bangalore. It was, because all of us required to change schools. My one brother was in 10th standard, the other one was in 2nd PUC, which were crucial years, and they couldn't be moved at that point of time. So it was a tough decision, but Bishop Taliath, he wouldn't take no for an answer. And to tell you one anecdotal thing, he used to send my dad prices of vegetables, the school fees structure in Bangalore, the advantages of children being in Bangalore and getting educated here, just to entice him to come. And finally, I think he told him that St. John's is the one of a kind medical colleges, or only Catholic medical college in the country, and what it stood for, the values it stood for, the societal values it stood for, also the rural orientation towards it. I think that must have tipped in favor of him coming to St. John's. I was 13 at that time, and I was in the 9th standard, and parents felt that I couldn't be moved. I was put in the boarding there in Trivandrum. I was in the boarding for 2 years till I completed my 10th and then moved to Bangalore. Oh, Bangalore was like going to, at present, going to some foreign country. We have never been outside Kerala. So, things were, and it was a much cold. And the month they moved to Bangalore was December. You may imagine it was really cold, got sweaters. And my mother used to knit all the time. About a couple of months before moving here, she was knitting frantically to make us sweaters so that all of us could have sweaters when we came here, So, and the place was, she used to describe it as, it is so beautiful. Flowers, fruits, and vegetables so fresh, which you never saw in Kerala. We used to go to Russell Market, and she enjoyed shopping in Russell Market. They stayed in the quarters, specifically C3. That's where we stayed in the initial few years. And in fact, all the neighbors were immediately our friends. And so on one side, we had Dr. Lucy Taliath, who was the head of gynecology at the OB and gynecology. She was sister of Father Jonas Taliath. And the other side neighbor was Dr. Tankam Joseph. And we never felt, out of place, or, it was like being at home. All neighbors were friends. We had Dr. Kalyankar behind us, Dr. Sharma's behind us. And, the whole campus was just like a big family. So it was good. Everyone gave us pointers to do what to do, where to put your children in, and all their children used to go to the same schools and colleges as we did. He joined as the dean, but he also worked in the Department of Physiology, because I remember him taking classes at least for our batch. I really remember he took classes, theory classes and practical classes for us. He was mostly involved in administration, but he did get involved in Department of Physiology also. From my memory, that took place in Delhi, I think. It was a signing of a USAID grant for St. John's by the then ambassador Daniel Patrick Mohinian, and my dad. That was the signature for the grant which USAID gave St. John's. I think it must be around 1975, 76, if I'm not mistaken. So I don't know more what happened during that time, much of what happened during that time. But after I joined the college, there were some challenges there, and I remember we going on a silent protest march in the streets of Bangalore. We started from St. Patrick's Church. All of us marched along MG Road. This was because there was some trouble with the affiliation of the college and the university. The Bangalore University was not willing to give affiliation to St. John's Medical College. So that was a challenging time, and that was when this protest march took place, and then finally we got the affiliation. So that was one important event in St. John's which happened. I think it was in 1978, 79, if I'm not mistaken. Yeah, he was a very strict. Everyone was scared of him, and they knew if you had done wrong, he is not going to take a light view of that. But I can't just remember, out of the thing that whether there's a particular incident I can talk. He was a disciplinarian, and as his age advanced, even at home we could see that he was becoming softer than earlier. But he was a disciplinarian. he used to stick, rules. He used to stick by the rules, and there was no, that one for favoritism for one person versus another. He used to stick by the rules and go according to that. Yeah. He was very much interested in research, and I think somewhere in the late 60s, 1960s, he was a visiting professor in Toronto University. So one year he spent just doing research there. So that was the level of his interest. And he left the whole family back in Kerala, and he was in Canada for a year doing research. And because of that research orientation, the university wanted him to continue there, but he came back to Kerala and continued his work in Kerala. So that's the level of his interest. So he wanted to promote interest, and although he started the research society, I don't know how much research was being done at that point of time in the society as such, but in individual levels, in individual departments, there were eminent senior professors and faculty who were doing research. For example, in anatomy, you have Dr. Manorama Thomas in genetics, Dr. Prakash Shetty was in nutrition, and Dr. Prema Bhatt in microbiology. She was doing some research in malaria eradication. So there were a lot of senior faculty who were interested in research and who were doing research. So I think that was what motivated him to start the research society in St. John's. Yeah. There was although we are not having cutting edge research labs or anything like that, but there was sufficient equipments and facilities to do research uh, at that time, and the hospital was just coming up, and our lab services in the hospital side was may not have been up to all the in par with AIMS or PGI Chandigarh and things like that. But we were developing the labs there. But research labs were still there, and it was good because most of the faculty had moved from CMC Vellore and come to St. John's. There are a lot of faculty. So there they were already doing research, and they continued that research at St. John's. These are I'm talking about the first senior faculty who joined St. John's. Dr. Tankam Joseph, she was in pharmacology. Dr. Manorama Thomas, Dr. John Thomas in pathology, and I don't know from where Dr. Prema Bhatt came from, but Dr. Rajni Makadan also came from CMC, I think. So there were quite a few of them from various places. Yeah. In 1975, solely in 1975, the building was completed and it was inaugurated. So there was not much happening in St. John's at that point of time. When I joined in 1978, we still had postings. That is 1.5 years later, we still had postings in St. Martha's. It is only during my final year that I think we completely pulled out of St. Martha's and started the entire clinical posting for undergraduates in St. John's. As an anecdotal thing, when I finished my 10th standard, that was in 1976, there was a big gap between my school year and the time I joined PUC. So I worked as a volunteer in the CSSD in St. John's. So we used to collect, syringes. That time it was glass syringes and metal needles and all these kidney trays and all that, collected from the casualty, that because there were hardly any departments working at that point of time, and we used to collect it and take it to the CSSD for cleaning. And because my dad didn't want me to sit at home and do nothing, so he said, why don't you just come and volunteer in the hospital? So that is my first impression of St. John's Hospital. But then gradually over a period of time, patients started coming to know about St. John's, and a lot of faculty from St. Martha's moved to St. John's. So they brought in their patients who were following up with them there, and each department gradually developed. But it was a slow process. So till 1980, 82 or 81, 82, we still were going to St. Martha's for our clinical postings. Some of the doctors still continued there. We had Professor of Medicine, Dr. Reddy, Dr. Seth, all of them, I think they continued in as part of faculty of St. John's, but they continued in St. Martha's. We had Dr. Sridhar, Dr. Dore, Dr. A.N. Balasundaram, all of them moved from, they all professors in medicine, they all moved to St. John's. Surgery doctors, Dr. Muni Reddy, Dr. Alfred Masculinus, all of them also came to St. John's and worked in St. John's after that. Maybe half the faculty there moved back to St. John's at that point. Ethics in medicine was one of his another favorite topic. He was including other than just so he felt that he has to, everything has to be done in ethical manner, especially treatment, patient treatment, and no one should take advantage of someone else. And because of that, I think that must have motivated him to write the book in ethics. And he did write 2 or 3 editions of that. And then later on, no one could take it forward, and then someone else had to, edit it and do it after he passed away. So yeah, definitely he was very principled man with ethics as a very important part of his life. He didn't do anything which was unethical, and so he felt no one should treat anyone, even patients, in an unethical manner. So I think that must be the main reason, and he wrote the book, and he wanted it to be included as part of the syllabus of undergraduate training, so that the doctors coming out of St. John's or any other medical college should have some idea of what is medical ethics and how they should go about, about the treating the patient as a person and not as a patient who can be experimented on. So I think that is the main reason he went to that, and then he was part of the Senate or syndicate, and he made the university take up that thing and make it part of their curriculum. And we had ethics classes way back. I think I remember even soon after my dad joined itself, I think we had ethics classes going on in St. John's. And I think Father Kalam was taking those ethics classes for us when we joined St. John's. Yeah. Even in Kerala, when he was a principal of the medical colleges, he told the students, and he wanted the students to have some community orientation and community experience. So he used to do some work in that also for the medical college students. I think once he came here and he had, he knew he could implement such things, so he went into that area more in a more better manner. And as Dr. Ravinarayan sometimes calls him, his initials stand for Community Medicine Francis. So he used to go, I remember him going to one place called Malur, which was for one of the first community outreach programs from St. John's. It is a village where silkworm industry is there. So I don't know whether we are still connected with Malur or not, but that was the first place he used to go, and he used to take us along with him sometimes when he used to travel to Malur. And, we used to go meet the people, see the silkworm industry, how it was going on, small, with the mulberry plants and the worms getting the whole process. So that was the first outreach program I think I remember him going to. Then we had the other outreach programs like Muglur, all starting up. So we used to travel mostly by the college van. We had 2 small vans which the drivers used to drive, and we used to go in those vans to Malur. The roads were not good, especially just out of Bangalore. The roads were really bad, and and it took us, if today it will take you half an hour, it took us more than an hour to reach that place. So the travel was not very easy, and also you don't get food or drinks on the way. Nothing was there. You had to take it either with you or have it with the villagers there in Malur or in the community's health cell there. So that was the thing, and travel was never easy that time. Even once after Muglur started itself, the travel was not easy. Only now travel to Muglur is, all the tarred roads and good roads now. We reached there in no time. So you didn't have the BDA complex there. It was mangroves there with forest land there. BDA complex came up much later. We used to have an ice cream shop little down the road where we used to go have ice cream as students, and we used to go for picnic along Sarjapur Road. So there was no development at all in this area at that point of time. He was always writing. Even a month before, no, a few days before he passed away, he was writing something. He was filling in notes to, write the next edition of the medical ethics book. So I have got those personal notes in that book. The last edition, he was just filling up, writing in his own handwriting and putting in notes where he wanted to add to the previous edition. So he was always writing. So I do, and he was very interested in writing and publishing books. This is the second book which is still there. And he wrote it by himself, and later he wrote it along with Dr. Mario D'Souza, who was the assistant hospital administrator at that point of time. And they brought a second edition together, and then there is the third edition. So that is about the hospital administration book. And so the hospital administrator at that time was, I think, Bishop Morris. There was a little friction, I know, when he took over as Dean of St. John's, because the senior faculty at St. John's felt that, why bring an outsider when there are people in the institution itself to take over. So there was a small friction at that time that I could feel when I was at home, or from the conversation I heard at home. But other than that, I am not aware of anything else. Yeah. Because he was a very private person, and never discussed all those things at home. Yeah, at home he was just a family man. Of course, he used to ask us to help out in various things, but nothing which was um, confidential, and things which if got to our ears, will spread to others. He was a very private person. So I don't know the details of those things. I think he felt that he has done what he could do, and it's time to move on. That's been always with him, and so that's when he decided, because he was just 58 when he left St. John's. So I don't think it was a formal retirement. Like they asked him to retire and go. I think he requested that he be let off, and he wanted to move on. That I think that was his decision. But what led to that decision, I'm not sure. But I feel he felt that he has done what he could do, and someone new need to take over and continue. He went to CMC Vellore, and he started their Department of Continuing Medical Education. So that is something, again, he started there, and then after 2 years, he came back, and then he joined St. Martha's as the director there of the hospital there, and he worked for some time there. And following that, but he was still, during all this time, he was still connected with the community health cell, that is the Sochara now, and he used to go there frequently, and he used to go for their meetings and help them out as advisor and things like that. But once he left St. Martha's, I think he spent most of his time at Sochara. I did my post-graduation not in St. John's, but in JJM Medical College, Davangere. uh, he he moved to CMC Vellore. At that time, I just finished my BBS in St. John's. And then when he was in St. Martha's, I had already moved out. I'd got married by that time and I'd moved out of Bangalore. I did part of my rural bond about a year in Chikmagalur. So Bishop Nathayas got me a position in one hospital in Chikmagalur, and I was working there. And after a year, I got married, and because of the compulsions, I had to leave the rural service and discontinue it and go with my husband. Yeah, he was out of the country, so I had no choice but to do that. So 1 year I did, and 1 year I deferred my bond. My husband was in Chennai for some time, so I worked in Chennai in a high hospital there. And in 1999, we moved back to Bangalore. It is at that time I joined St. John. So there I thought I have to come back here because I wanted to come back and work where I started off and where I got all my education, all my values. And I felt that most of the other hospitals at that time, um, you know, were not going along the ethical way things have to be done. So I felt I am a better fit at St. John's. So I joined that here, and I'm very happy I joined as a faculty here. And then till 2021, I remained a faculty, and it was a very rewarding career for me. Dr. Mary Olapalli was the dean at that time, and she said, "Why don't you join?" And she encouraged me to join St. John's. So my eldest brother Matthew, he is a 1975 batch of St. John's, and my sister Annie, she is 81 batch Johnite. So my brother did do his rural bond 2 years, completed his rural bond, but he did his post graduation in Trivandrum Medical College in pathology, and then following that he continued to work in the government medical colleges in Kerala till he retired. My sister Annie, she's 81 batch, as I told you. She is at present in the US. She's a internist in internal medicine, and she's in the US. So there are two doctors now in the next generation. There are two doctors, both are girls. One did it in Father Muller's hospital, and she's now doing medicine there, general medicine there, while the younger one, my younger brother, my second brother's daughter, she is a 2005 15, so 2015 graduate of St. John's. So she's the second generation Johnite there. The biggest change is the expansion, the number of buildings which has come up, and the number of students which are overflowing in St. John's now. So when I joined St. John's, or when we came, it was just the medical college with 60 students. That's all. So no more, 60 per batch. So 60 into 5, 300 students. There were no nursing college students also at that time. Nursing school started sometime, I think, in the 1980 or so. And no other courses were going on at that point of time. So hardly any students, just 60 students, and the faculty to look after those 60 students. So it was a very small community, and the hospital was just coming up. There was a college building. There was a nurses hostel, and college, and across the road you had the students hostel with the grounds and with quarters, which we had maybe a few buildings, not so many as it is now, but the expansions now the whole area is covered with buildings. And there are, if you just step out on the road or into the corridor, there is a lot of students. You can see students everywhere who are in various courses in St. John's, allied medical, nursing students, nursing, and the faculty also, number of faculty and the support staff for them. The whole place is now milling with people, and a lot of buildings too. That's a change, massive change I've seen. I think it is inevitable when the numbers are so big that connect between everyone, from the faculty to the students, to faculty among themselves, to the management, that has got lost. I think earlier it was just the management, the faculty, the students all were part of one community who were involved in decision making, uh, you know, with each other. Like even the students were the students, I feel there was a student committee. I remember them coming home to discuss things with my dad. If things were not going okay, they used to come home. The secretary, the president, or the elected leaders, they used to come home, discuss that kind of thing. I don't think is happening now. That connect, I think, and it's not possible because of the massive numbers and the size of the institution. That one-to-one connect, that is what is, I think, missed out in all that.
Mhm.
Definitely, it was very important. I think St. John's was always oriented towards cultural activities and sports events. And I was just talking and to my siblings today morning, and they were saying we used to take part in the sports activities. There used to be, all the faculty used to bring their family along, the children along, and there used to be events for sports. During the sports day, we were invited there and we were asked to take part in that. So it was, it was a small community and we could do that. So we used to really enjoy that. And something which I want to tell, because I don't know whether we are running out of time. Uh, the trees you see around in the campus, that is part of my dad's initiative, because he was interested. Wherever he went, he used to plant trees, and he wanted to, in the whole greenery to be around. So I remember, I think in the year 75 or 76, on a Gandhi Jayanti day, he organizes Ramadan with the students, make them all, plant trees all around campus. I think some of it is still there. Some of them have been cut down to make way for buildings. But that is something I wanted to tell. He was very conscious about the environment where we are staying in. Another thing is the yearly Christmas and Easter um, celebrations. Again, it was every one of the most of the faculty used to come to St. John's to attend Mass. And one year, I remember there was a quarry just behind the nursing hostels. There's a quarry which was going deep down. The Easter Vigil service was conducted there. And that is a vivid memory for me, because chaplains during that time was Father DL and Father Bywood. They were Irish priests, and they may had innovative ways to involve students to attend mass and religious events. So that is something which comes to my mind.